Debunking common skincare myths. Hello and welcome to the channel. I hope you had a happy and healthy new year. May 2025 bring you good bodily health and soundness of mind. Today's video is a follow-up to my last video on skin medicine. How to keep your skin youthful and glowing. Daily tips you need. Commenter Aliza Maris asked me to do a video debunking common skincare myths. Excellent video idea. I thank you, Aliza Maris. Skincare has evolved into a multi-billion-dollar industry with an overwhelming number of products, regimes, and advice available to consumers. However, with the abundance of information also comes a significant amount of misinformation. From miracle ingredients to myths about skin types, countless skincare myths circulate on social media, beauty blogs, and even in dermatologist offices. Here are a few myths I have gathered together, so let's go about debunking them. Myth number 1. Expensive products are always better. One of the most enduring myths in skincare is that pricier products are always more effective. Marketing often equates high prices with better quality, but the truth is not always so clear-cut. Of course, that efficacy of a product depends on its active ingredients and how well they are formulated, and not necessarily on the cost. Many expensive products contain luxury packaging or exotic ingredients that are more about marketing appeal than real results. For instance, some high-end moisturizers may contain antioxidants or peptides that are available in more affordable formulations. It is important to note that the base of many skincare products, such as water, emulsifiers, and preservatives, are often inexpensive and do not contribute to the high price. On the other hand, some lower-priced brands may have an equally effective formula, sometimes even using the same active ingredients. The key to effective skincare is understanding the ingredients in a product rather than being swayed by its price tag. Number 2 myth: you should never use sunscreen on oily skin. Many people with oily or acne-prone skin mistakenly believe that sunscreen will clog their pores and worsen breakouts. Whilst it is true that some sunscreen formulations can be too heavy for oily skin types, the idea that sunscreen should be avoided is entirely unfounded. Sunscreen is essential for protecting the skin from harmful UV rays, which can lead to premature aging, pigmentation, and skin cancer. Oily skin types can benefit from lightweight, non-comedogenic, acne-inducing sunscreens designed specifically for their skin. Modern formulations can often offer gel-based or oil-free options that provide adequate protection without causing clogged pores. In fact, UV exposure can actually increase oil production and exacerbate acne. Thus, using a non-comedogenic sunscreen is crucial for maintaining skin health, even for those with oily skin. Myth number 3: natural or organic products are always safer. With a growing trend of natural skincare, in inverted commas, many people believe that organic and plant-based products are inherently safer or better for the skin. While natural ingredients can certainly be beneficial, they are not always the best for every skin type, nor are they always safer than synthetic alternatives. First, the term natural is not regulated in skincare, which means that products labeled as such can still contain ingredients that are irritating or harmful to the skin. For example, some essential oils and plant extracts can cause allergic reactions, sensitivities, or phototoxicity, sensitivity to sunlight. Additionally, organic does not automatically mean more effective or gentler. Some natural ingredients can be comedogenic, pore clogging, irritating, or otherwise otherwise unsuitable for certain skin conditions. Synthetic ingredients, when formulated correctly, can be just as safe, effective, and often more stable than their natural counterparts. For example, vitamin C in the form of ascorbic acid, a synthetic derivative, is more stable and effective for brightening skin than some plant-based alternatives. The key to selecting skincare products is to focus on your individual skin needs rather than relying solely on marketing terms like natural or organic. Myth number 4. You shouldn't moisturize oily skin. A common misconception is that oily skin doesn't need moisturizing as it produces enough oil on its own. This myth has been perpetuated by those seeking to manage excessive shine and acne, believing that moisturizing will only exacerbate these issues. However, the opposite is often true. Oily skin can still benefit from moisturization, particularly because over-cleansing or using harsh ingredients can strip the skin of its natural oils, leading to increased oil production as the skin attempts to compensate. The key is choosing the right moisturizer, preferably a lightweight, non-comedogenic, non-pore clogging product that won't add excessive grease. A proper moisturizer helps maintain the skin's moisture balance, preventing the overproduction of oil. Furthermore, some moisturizers contain ingredients like salicylic acid, basically aspirin, or niacinamide that can help reduce oiliness whilst simultaneously improving skin hydration. Myth number 5. Acne is caused by dirt and poor hygiene. Now, this is a myth I come across a lot amongst my younger patients. Acne is very much misunderstood, and very often it is thought to be a direct result of poor hygiene and dirty skin. While maintaining a clean face is important for overall skin health, acne is primarily caused by factors like hormonal changes, which is why we see them in teenagers and pregnant women. Genetics and inflammation also play a part, but not poor hygiene, not dirt. Clogged pores and overproduction of sebum oil and the presence of acne-causing bacteria are the main contributors to the formation of pimples. Now, we all have so-called commensal bacteria on our skin. Just because someone has a bacteria that then exacerbates a predisposed or an underlying acne problem doesn't mean that they are dirtier than the next person. We all have certain bacteria on our skin, particularly Staphylococcus aureus. This is well known. Some people have the methicillin-resistant one, which makes it a problem if you end up in hospital, and you need then to be isolated from others, because if you do have a problem from these commensal bacteria, unfortunately your healthcare providers then cannot treat it effectively, particularly if you are at risk, if your immune system is reduced for one reason or another. And this is often the case in hospitalized patients. So just to get back on track, we all have bacteria on our skin. So someone having acne where an infection exacerbates the pre-existing problem of clogged pores does not mean they are dirtier than anyone else. Very important. If you take nothing away from this video, please take this message home. Harsh scrubbing or overwashing the skin can irritate it and strip it of its natural oils, potentially making acne worse. Instead, gentle cleansing with a mild, non-irritating cleanser is recommended. Acne treatments should focus on regulating oil production, reducing inflammation, and addressing bacterial overgrowth, often through ingredients like salicylic acid, benzoyl peroxide, or retinoids. While regular cleansing is essential, it is a combination of other factors, including lifestyle, diet, and genetics, that contribute most to the development of acne. By the way, I mentioned retinoids. as part of the treatment strategy for acne. Very important to note that we doctors, well, not particularly a GP, especially dermatologists, we will always be very, very reticent about giving retinoids to a woman of childbearing age. If your dermatologist doesn't want to give you Roaccutane or something similar, please be aware that these medications can be what we call teratogenic. They cause abnormalities in a fetus. And I hear this all the time, but I'm never going to get pregnant. Yes, okay, we believe you. This is a common problem that we face. It is very common for women to get pregnant, even without their knowledge, for at least 6 or 7 weeks. And it is during this time that the medication, if you're on it and pregnant, causes the most damage to your baby. So, unless you are willing to take the risk yourself, in which case you may have to sign a waiver or something, most doctors would really hesitate to give a young woman retinoids. But there are other strategies to treat acne, thank goodness for all that. And so the best option is to try all the other treatments first. If we really are desperate, your acne is resistant to any other treatment, then we may have to see how we go about making sure that you can safely take the medication without a risk of an accidental pregnancy becoming a tragedy for you. Myth number 6, you can shrink pores. Many skincare products claim to shrink, in inverted commas, pores, but this is a misleading promise. Pore size is largely determined by genetics, and no product can physically shrink pores. However, certain factors can make pores appear larger, such as excess oil production, clogged pores, and loss of skin elasticity with age. What skincare products can do is help minimize the appearance of pores. For example, using exfoliating ingredients like alpha hydroxy acids, beta hydroxy acids, or retinoids can help remove dead skin cells and reduce the likelihood of clogged pores. Additionally, using a mattifying primer or oil-absorbing ingredients can give the illusion of smaller pores, but these are temporary effects, I'm afraid. To manage pore appearance, it's important to focus on regular exfoliation, maintaining a healthy skin barrier, and using products that balance oil production without irritating the skin. Myth number 7, all you need is a cleanser and moisturizer. This is a tough one. Many people simplify their skincare routines to just a cleanser and moisturizer, thinking that's all that's necessary for healthy skin. While these two products form the foundation of a skincare routine, they often overlook other important steps and active ingredients that can make a significant difference in skin health. Cleansing and moisturizing are important, of course, but they alone do not address concerns such as acne, pigmentation, or signs of aging. Serums, toners, exfoliants, and sunscreens can provide essential benefits like treating hyperpigmentation, protecting the skin from UV damage, ultraviolet damage, and boosting collagen production. A well-rounded skincare routine includes ingredients that target specific skin concerns and help maintain overall skin health. In addition, many people overlook sunscreen, which is one of the most critical elements of a daily skincare routine. Consistent sun protection is key to preventing sunburn, premature aging, and skin cancer. And by the way, this applies to everyone, no matter what your skin color is. Myth number 8. You need to use multiple products to achieve results. Now, this is kind of a corollary of the previous myth. Whilst you do need a certain minimum, you can also have too much in the way of skincare. In the age of social media, people are often encouraged to use an excessive number of skincare products to achieve perfect skin. However, more is not always better. And layering too many products can lead to irritation, clogged pores, or compromised skin barriers. A simpler skincare routine with well-chosen, effective products can be just as, if not more, effective than one that involves a plethora of steps. The focus should be on quality over quantity. Overcomplicating your skincare routine can lead to diminishing returns as the skin becomes stressed or overwhelmed. Using too many active ingredients at once, such as multiple acids or potential retinoids, can also lead to irritation, sensitivity, and increased risk of side effects. The goal should be a balanced routine with targeted treatments that address your specific needs. In fact, I would really stress the point that where skin is concerned, less is definitely more. Makeup and other skincare products can be very irritative to certain individuals' skin. I'm not saying that they're necessarily harmful, no, but certainly irritative. Always do a test drive before you commit to new skincare products. If you're allergic to it or if it irritates your skin, you should find out in only a few hours to days. If you experience allergy or irritation, stop the product immediately, of course. Wash it off and consider using antihistamine medications to reduce the allergic reaction. Always with the doctor's advice, of course. If symptoms of the allergy or irritation persist, you may even need steroid treatment in addition. For sure, if you start having funny sensations in your mouth, in your throat, or on your tongue, your airways, your breathing apparatus might be at risk. It would be best to present yourself to an emergency room and get checked out. Observed, maybe just overnight, maybe a few days, depending on how severe the reaction is. And remember that even when an allergic reaction appears to be going away, it can always come back and trip people up. I've had this experience where someone's been sent home from hospital only to come back a few hours later with a swollen throat and they can't breathe anymore. Please don't take any chances. Myth number 9, and this is my final myth. You can't use retinol in the daytime. Retinol, a potential derivative of vitamin A, is a popular anti-aging and acne-fighting ingredient. We've talked about this. Retinols and retinoids, however, are teratogenic, so young women, please be informed about this and be prudent when it comes to using retinols. There is a common misconception that retinol can only be used at night because it makes the skin more sensitive to sunlight. While this is true, that retinol can increase sensitivity to UV rays, this does not mean you should avoid using it during the day. The critical factor is ensuring you apply sunscreen daily, which is essential when using retinol or other active ingredients. Sunscreen protects the skin from UV damage, which can be exacerbated by retinol use. As long as you apply a broad spectrum sunscreen with a high sun protective factor SPF, you can use retinol during the day, but most people prefer using it at night to avoid any potential issues with sun exposure, which is fair enough. All I'm saying is it doesn't have to be limited to daytime use. To conclude, while skincare myths abound, understanding the science behind skin health can help dispel common misconceptions and lead to more informed choices. From the idea that expensive products are always better to the belief that oily skin doesn't need moisturizer, many skincare myths simplify or misrepresent how our skin functions. Ultimately, skincare is not about following trends or adhering to myths, but about caring for your skin in a way that promotes long-term health and well-being for your skin. Do you know other skincare myths that I have left out? Feel free to let me know. Do you have any medical issue that you would like me to discuss? Follow the example of Elisa Morris and drop me a line. Ask away. Askadoc.